All right then, this here's Glenn Campbell. I'm talking to you from the woods of beautiful South Carolina, somewhere in the woods of South Carolina, and I'm here today to talk to you about health care. Now, you never would thought in a million years I'd be talking about such a political topic as health care, because you know I like to steer clear of them political topics, like get people all riled up, you know, so that's not me. But some things about this healthcare thing I just need to get off my chest. So this is a little opportunity for me to explain to you what healthcare is and why this whole old universal healthcare thing just can't gonna work. It just ain't gonna work. You see, now, let me back up. I think it's tragic thing that poor people can't get decent healthcare in this country. All the decent health care goes to them rich people. People can afford them big fancy insurance programs. Poor people in this country are getting screwed. I'm acknowledging that. I'm acknowledging that poor people should not have to die of preventable diseases. But, you gotta realize how much health care costs. We can't spend gazillions of dollars when our deficits are all down the tubes. We can't ever do it. I don't believe we can ever spend enough money to bring everybody up to the same level of health care. Let me explain why that is so, that no government on this planet can pay for all the health care of all its citizens. The reason being the health care thing, the health care costs just go way up, and basically people can't pay it. Only the rich people can pay those astronomical fees, but that's simply the way it is. Back in the old days, think way back in the old days, people didn't live very long. You'd be lucky to live 40 years. 40 years tops. You know, that's an old man back in the old days, you know, the Bible days. Nowadays, people live in 60, 70, 80, 90, 100 years. How's that happen? Well, it's technology, I tell you. It's technology. Medicine technology keeps getting better and better and better all the way up the line. People 90 years old are 90 years old because they got good medicine all the way along the line, but that medicine costs money. Lots of money. You get to be 90 years old, you spent $1 million on health care. Them's the facts of life. We can't possibly spend $1 million on every individual in this country out of the government coffers. It's just not possible. And the thing just gets bigger and bigger and bigger. Yeah, we'll be living to 120, 130, 150, but at what cost? And sooner or later, they're gonna put you take your head off, put it in a jar, hook you up to the internet, and keep you alive forever. But it's gonna cost money. It's gonna cost an infinite number of money. You understand? Right now, healthcare is the #1 industry in this country, and there's a reason for that. It just keeps growing and growing and growing, and as people live 120 years, it's gonna be growing and growing and growing. And no government on this planet can pay for all that. The only way it happens is you got to pay for it yourself. And frankly, the rich people, the people with $1 million, they're going to get the better health care. There's just no way about it. Now, I'm as much opposed to that as anyone, but them's the facts of life. Looking at the other end of the scale, used to be half them babies that was born died before they was born, you know, I mean, or right after. Now we got them neonatal units. We got them preemie units. We take them preemie babies and we put them in little boxes, you know. Put them babies in boxes, little tiny babies that should have died, you know, would have died long ago. Put them in little boxes, hook them up with little tubes, and keep them alive. And that's a miracle. I mean, I'm acknowledging as much as anyone, that's a miracle, keep them little preemie babies alive. But the point is, it costs money. It costs money to keep them babies alive. It costs $1 million. Now, it ain't unusual to spend $1 million to keep a little preemie baby alive. So the preemie baby goes up, he got a lot of problems, because he's a preemie. He's going to have lots of medical problems all the way along his life. we'll spend more money on him. If that little preemie baby is in the government system, government got to pay that money. $1 million to keep a little preemie baby up. The point is, with that $1 million, you could address the healthcare issues of a lot of grown-up children. You know, a lot of problem children that just got little problems that cost a few $1,000s. We spend $1 million on a little preemie baby. We can't spend $1,000 on some other little problem and help a whole lot of children. We got to help this one little children. Trouble is, government ain't equipped to make them decisions. If a baby's dying there in the hospital got to put all it can into them little babies. While the older babies who don't get the $1 million, the older children, they got no say. They got no, they got no ability to fight back, because that's just kind of preventative medicine as opposed to acute medicine. The more of this stuff you pile on to the government, the more crippled the government becomes, because government can't solve these little problems of the little preemie babies. All these problems of these people just keep living and living and living and taking up all the medical care. The government can't say on the other end, okay, you're 90 years old, we ain't going to treat you no more. You're 90 years old and you got some sort of operation we could do to keep you to 91. We're going to put $1 million into keeping you up to 91. You get what I'm saying there? You get what I'm saying there? I mean, this whole healthcare thing is unlimited. You just can't keep spending money, on lost causes. You can't keep spending money on little preemie babies, or you can't keep spending money on people who are going to die anyway. Government can't make these decisions. The only person who can make these decisions is the capitalist system. It can make these decisions by default. You understand? What I'm saying is, government gets involved in healthcare. Government's gotten involved in something way over its head. Believe me so. It ain't going, it's just a nightmare. Because government can't say, no, I'm not going to do this. Only people can say that, and only, frankly, money can say that. Money is the only thing that really say no to the healthcare thing. Money's going to say, we can't treat you because you're 90 years old. I mean, they can't say that. They can say, we can't treat you because you ain't got no money. So that's what's happened today. It's a cruel system. It's really darn cruel. People spend up to their limit of health insurance, up to their $3 million limit on their health insurance, and they got cancer, and they run out of health insurance. Well, they're not going to be treated. They're going to die, and that's tragic. But he had the government step in. Government's supposed to spend $10 million more of the public money to keep these people alive. You understand? I'm getting a little bit heated about this, but you understand that health care is unlimited. The costs of health care are unlimited. So you can't get the government involved because the government won't know how to make those decisions of when to cut off the care. Fact is, it's the rich people going to live longer. The folks that got to get their head put in the jar, that's the rich people. They can afford the jar, they can afford all the wires and things that hook up to the jar. Them's the rich people, and that's tragic. But that's the fact. And frankly, you should be fortunate enough to live beyond 40, like the old people did in the Bible times. I just don't see the government solving these problems. Well, that's all I got to say. I got to get off my chest at least. Bye-bye.